With me now is Dr. Bruce Aylward. He is Senior Advisor to the Director General of the World Health Organization, and he is a Canadian. Few have seen this pandemic more up close than Dr. Aylward. Dr. Aylward, we last talked 18 days ago. You said then that the world was at a tipping point. Have we tipped?
Yes, indeed, Donna. As you've seen, since we last spoke, the Director General of WHO has declared a pandemic, and that's a result of changes in what we know, or more, I guess, of what we know in terms of the severity of this disease, the scale of the disease, the societal disruption it can change, as well as the speed with which it can spread. And as you've seen today, we have over 300,000 people infected with this disease in over 185 countries now.
You know, Dr. Aylward, when we talked last, you told me the most critical thing for any government around the world is speed, to act fast, to plan for what's coming. When you look around the world now, do you think that warning was heeded?
I think people tried to, Donna. Countries realized that this virus was coming. They were seeing other countries being hit along the way. But frankly, very, very few, if any, countries were prepared for COVID-19.
We're hearing lots of talk about the possibility of a drug treatment out there. Even the President of the United States talks about it. Can you give us straight talk on where we're at with drug treatments and human clinical trials?
Well, the bottom line is right now we do not have a silver bullet. There is no proven antiviral that is going to work against COVID-19. There is, however, a huge amount of work going on to test the available antivirals that already exist, some which are still trial drugs, some are which drugs we've known for a long time, like chloroquine. But at this point, none of these proposed therapies have proven to be effective in randomized clinical trials. And without such trials, you just cannot be sure whether or not you're doing more good than harm when you treat people with these medicines.
You know, so many of us are now cocooned in our homes around the world, not interacting with other humans. How will we know when it's safe to emerge and resume normal life?
Well, hopefully you still are, first of all, interacting with other humans, Donna, because, one of the tremendous things we've seen during this response is just, although people are cocooned in their homes, the extraordinary lengths they're going to interact with each other and to remain human. We are social animals, and it is such an important part of who we are. In terms of when we can emerge, what we really need to see is some of the heat coming out of this outbreak. You want to see two things. First, in terms of the outbreak itself, you want to see those case numbers coming down. You want to see a better understanding of what's really driving the outbreak, and that the risks in those areas are being managed. And then on the other hand, you want to see sufficient capacities in the isolation capacity, the quarantine capacity, et cetera, to be able to manage any resurgent disease as it comes up. So it takes a few weeks at least to start seeing these measures have an impact. And again, that's a little window of time in which you've got to get those other measures in place to be able to manage, the person-to-person transmission, the new cases as they come up. So it's a tough balance right now. The public health and health authorities are trying to manage everywhere, including right there in Canada, where you are.
Yeah, and there is pressure here in Canada for the government to act, to take stricter measures, to enact the Emergencies Act or use more of the quarantine powers. Is that kind of thing just inevitable in every country, that it has to happen, and maybe it has to happen now?
2 points on that. First of all, Donna, nothing is inevitable. Remember, we're dealing with a biologic process here with infectious disease, and what we're seeing is it behave differently in different populations to a certain degree. We wonder how much of that is just time, or how much of it is just the fact that some of this is unpredictable. But the The trick with this virus, though, a little bit like you said at the end there, is this is a virus that once it does take off, it's going to move and increase exponentially. And your measures, your control measures, have got to be exponential as well to get in front of it. So small incremental measures won't work. And if there's a sense that you're losing control of these clusters, losing control of these transmission chains, you want to be moving very, very quickly in terms of measures that are going to really prevent people from interacting in a way that's going to just add more fuel to this particular fire.
All right. Dr. Bruce Aylward, thank you so much for taking the time with us. We appreciate it.
My pleasure.